a case can be made that the reason for the collapse of Dama Hamlin could have been an underlying myocarditis, which amplified the phenomenon of commotio cordis, that is a blunt trauma to a certain point on the chest, given at a certain time in the cardiac cycle, which can trigger a lethal ventricular arrhythmia. And this, of course, has happened in his case. But there are people and respected people who can always say that, look, because he had been vaccinated, then he may have developed myocarditis, and this myocarditis has amplified or exaggerated this phenomenon, which ultimately led to his collapse and him being very serious currently and being in a hospital. So before I say anything else, first of all, I have been praying very hard that this young man recovers and recovers swiftly to his full capacity. What happens after that is a different issue altogether. But the point which I'm trying to make now is that yes, there is a probability that he may have had myocarditis, whether it was because he has been vaccinated, which he just might have been, or whether it was because of a viral infection, a recent viral infection, which had not manifested clinically. That is a moot point that can be debated. The fact remains that he has been admitted because of a collapse, and the only way, a reasonable way of confirming whether he had myocarditis is either by a cardiac MRI or by a histopath study, by an endocardial biopsy. That would confirm not only whether the myocarditis was there or is there, and whether it has been induced by a fresh viral infection or by something else, or whether it has been produced by the vaccination. However, the point I want to raise today is that there is this very interesting paper which was published in October 2022, that is about 5 months ago, in the European Heart Journal. This paper is from Israel, from Tel Aviv University. The first author is a young cardiology fellow by the name of, I think, Boris Shipman. But that is unimportant. I mean, in the sense that I don't remember the name of the first author. This is from an Israeli group published in the European Heart Journal in October 2022. The manuscript was submitted in January, and it describes these two men who had been infected by the Omicron variant, and both developed myocarditis and both land up in hospital. Now, we are aware that the Omicron variant, albeit being very infective and being very transmissible, much more than the Delta or the original Wuhan variant, the Wuhan virus, is not so lethal. In fact, the hospital admissions are 50% less than what was seen with the Delta variant or the original virus. So in simple English, by and large, it has been seen that the Omicron virus and its subvariants are clinically less deadly, less toxic than the previous variants of the coronavirus, the SARS-2 coronavirus. Now, in this paper, let me describe it in detail. The first person is a male, about 42 years, who was admitted, I think, on the 8th of January 2022 for chest pain. Now, the important thing is that this man had had a perimyocarditis in 2008, which means almost 14 years ago. This man had myocarditis of an unknown reason, and after that there was no recurrence, there were no symptoms pertaining to any residual features of that episode of myocarditis. So we have a man who is middle-aged, who presents to the hospital with chest pain and who has had myocarditis 14 years back. At admission, he has changes on his ECG. These changes are in the inferior leads of the 12-lead ECG. Also, his transthoracic echocardiogram shows that there is wall motion abnormality in the inferior wall, and also his high sensitivity troponins are very highly raised to the tune of more than 6,000 nanograms per liter. Now we have a man, middle-aged man, who has had myocarditis 14 years ago, who was admitted with chest pain, and this chest pain is accompanied by ECG changes, by changes in the echocardiogram, and with the significantly raised troponin levels. An angiogram is done which shows that the coronary arteries are clean. There is no significant disease in the coronary arteries. So a cardiac MRI is done which shows that there is evidence of edema, and apart from evidence of edema, there is also the evidence of fibrous tissue, in the sense that the late gadolinium enhancement is visible, and this is visible in the lateral wall of the left ventricle, and this is subepicardial in nature. Now if you see these LGE spots, that is the late gadolinium enhancement features on the cardiac MRI, and if they are subendocardial, then that means this is because of ischemia, this is because of a blocked artery. However, if you have these features in the subepicardial area, that is not in the subendocardium part of the wall of the left ventricle or the right ventricle, then that is most probably because of a non-ischemic reason. And in this condition, in this patient, this is because of a viral infection, because this man was tested for the Omicron virus and this came out to be positive. That means he had a nasal swab done. The RT-PCR showed the presence of a coronavirus. The sequencing was done, and that revealed that the person was having infection by an Omicron variant. So now we have a man who is middle-aged, who has had myopericarditis about 14 years back, presents with chest pain. He has changes on the ECG, on the echo, on the cardiac MRI. He has raised troponins. His coronary angiogram is clean, and the MRI is very strongly suggesting that he is having myocarditis. And above all, his nasal swab test tells us that the PCR and the sequencing are clearly indicating that the man is suffering from an infection by the Omicron variant of the SARS-2 coronavirus. Now, the other important thing which I must tell you, in fact, the most important thing, is that this man has already had 3 shots. The 3rd shot was given in August of 2021. So, despite 3 Pfizer shots, which were given to almost 90 to 95% of the population in Israel, this man yet develops, after 4 or 5 months, develops infection by the Omicron variant. And this also is nothing to be surprised about, because we know that the efficacy of the Pfizer vaccine starts waning very fast, and after the 3rd shot it wanes in within, I think, 2 months or maybe even less, and after that the vaccine efficacy is negative, which means that you are more vulnerable to an infection with the coronavirus. Now let's get back to the paper of which I'm talking about. This is now the 2nd case. The 2nd person was about 60 years. This is a male who also has had 3 shots of the Pfizer vaccine. The last shot was given by August of 2021. On January 11th, he was diagnosed as a case of SARS-2 infection by the Omicron virus, right? Because again, we have a PCR test done and the gene sequencing is done, and we confirm that the man has been infected by the Omicron variant. Now, this is on the 8th of January. After 10 days, the man, I think, is playing table tennis, and while he's playing table tennis, the man collapses. He's unconscious for 1 minute. He wakes up, and when he wakes up after a minute, he is feeling palpitations. He has palpitations, so therefore he is rushed to a hospital, or he goes to a hospital. When he arrives to the hospital, they find that he's having a very fast heart rate. The pulse is not palpable. He is having ventricular tachycardia at a rate of 250 per minute, for which, of course, he needs immediate cardioversion by a cardioverter. He's given a shock, and which then converts the ventricular tachycardia to an atrial rhythm of about 40 to 45 beats per minute. Now again, this man has been vaccinated 3 times. He has had an Omicron infection 10 days prior. Again, a test is done. Again, a PCR test is done, which confirms that the man is being infected at this point of time also. The infection is persisting. That means after 10 days of the initial infection, the index infection, the man continues to have Omicron virus in his system. And again, I repeat, this man has been vaccinated 3 times about 5 months back. And despite the 3 Pfizer shots, this Israeli gentleman, about 60-62 years, has presented with a pulseless ventricular tachycardia, which by any definition is a very serious condition. It is almost lethal, because this was a life and death situation for this man. He needed a shock in the emergency. Now, the other important thing is that both these men, while in the emergency, had an oxygen saturation ranging from 97% to 99%, which means that the lungs were not involved. Now, this particular person then was kept in the ICU, as was the earlier person. And in the ICU, there were a few episodes of self-limiting ventricular tachycardia of 5 beats, but not more than that. But apart from that, there was no serious ventricular arrhythmia in the ICU. So the man was kept on a beta blocker, that is bisoprolol, I think just about 2.5 milligrams once a day. And no antiarrhythmic was given to this man. Now again, this man also had changes on the ECG in the inferior leads. There was a ST elevation in the inferior leads. There were changes in wall motion in the inferior wall and on the 2D echo. The troponins were raised, in this case about 4,000 nanograms per liter. That is a significant rise in troponins. So we have a person who has been vaccinated 3 times, 5 months ago by the Pfizer vaccine, who develops a corona infection with the Omicron variant and presents to the hospital with a sustained monomorphic ventricular tachycardia at a rate of 250 per minute. There are changes on the ECG, there are changes on the echocardiogram. The MRI is done, which shows once again that there is late gadolinium enhancement, which means that there is fibrous tissue in the left ventricle. And in the first case, this was to the tune of about 22% of the left ventricle. In this case, it is about to the tune of 19%. So therefore, there is significant infection by the coronavirus, that is by the Omicron virus. And this man was discharged. The man with the ventricular tachycardia is discharged with a wearable defibrillator. After 3 months, he is brought back, and this time a permanent implantable cardioverter defibrillator is installed in this man. And a repeat MRI again shows that there is persistence of the changes in the left ventricle, that is the changes suggesting fibrosis by the late gadolinium enhancement, though are slightly reduced from 19 to 16%. They are still there, and that is the reason why this man has an implantation of a permanent ICD. So now, what is the purpose of this particular study? The important thing is that we have a situation, has been reported for the first time, that despite the fact that these 2 men were infected by the Omicron variant, which is supposed to be, and which by and large is a less toxic, less virulent virus than the previous strains or the previous variants of the SARS CoV coronavirus, these 2 people have developed myocarditis. Now a case again can be made that maybe the myocarditis was because both of them had been vaccinated, both of them have been given 3 shots of the virus of the Pfizer vaccine. No endomyocardial biopsy has been done. No histopath information is available. But then again, that is simply a matter of debate. The more important thing which I feel is that despite 3 shots of the Pfizer vaccine, we have 2 men who get infected by the Omicron variant. Of course, we know that the Omicron virus is very dodgy, it is very immune evasive, it is capable of evading any form of immunity, whether it is vaccine-induced immunity or whether it is natural immunity. But the fact remains that despite 3 shots of the Pfizer vaccine, we have 2 men who develop myocarditis. Both have a PCR test done which confirms that they are infected by the Omicron virus. And in both cases, the situation is not mild. Both of them develop myocarditis. One person presents with chest pain lasting 3 to 4 hours in one instance, and the other man is admitted with a ventricular tachycardia. So I don't know what the authors are trying to tell us. Are they trying to tell us that, look, the Omicron variant is not that simple, not that feeble as presumed? It can hit the heart. Not only can it hit the heart, it can produce myocarditis, and therefore you should take another booster shot. Or whether we are being told that regardless of the number of vaccine shots we take, we still can get infected by this Omicron subvariant or the viruses roaming around nowadays. And not only can we get infected by the subvariants of the Omicron virus, there is a possibility, there is a distinct possibility that this virus can induce myocarditis. So therefore, ladies and gentlemen, the purpose of presenting this paper is that one has to be aware of these facts, that not only can the virus directly hit the heart, but we also know, and this is well known, that the vaccine, particularly the messenger RNA vaccines, are well known to induce myocarditis. Thank you very much.